Hello, good afternoon, good morning, good evening. Where are you watching us from? Please let me know in the comment section. Thank you for coming back, guys, and supporting my channel. And today we are going to talk about subcutaneous injection in the Osce, how we do it within the time provided and how we can do it without making any errors. So without any further delay, let's start the video. As we all know that there is a marking grid that we need to follow to pass the exam, to pass this OSCE exam, whether it's assessment, planning, implementation, or evaluation, or any skill. We need to know the marking grid. And while preparing for the OSCE, you need to make sure that you know the marking grid, what its criteria, what's its procedure. So we always start with the pre-procedure. But remember, assessor may say that you can skip pre-procedure and introduction. It's all been done. Just start with the actual procedure. So keep in mind, just be in your senses, and then make sure you know, you would know when the assessor is saying start with the actual procedure. Practice doing it at home, practice doing it with the actual procedure, practice skipping pre-procedure and introduction. So we are going to do subcutaneous injection today. We will start with the pre-procedure. I can never say this word. Pre-procedure. So in pre-procedure, what we do in the pre-procedure, you need to make sure your scene is safe. Patient privacy is maintained, and then you do your hand hygiene in the pre-procedure check. So you can say, I entered the room, I checked for the scene safety, my scene is safe, there are no trips or hazards in the room or anywhere else, and I'll draw the curtains for patient privacy, and now I'm gonna do my hand hygiene. So you need to state all the process of the hand hygiene, how we do hand hygiene. You need to take ample amount of alcohol gel. If you have sink, if you want to wash your hand, go ahead and wash your hand, but state all the process. And if you're using hand gel, you need to tell that the assessor, I'll take ample amount of hand gel, I'll rub my hands palm to palm, palm over dorsum, fingers interlaced, interlocked, all the process involved you need to tell the assessor. Okay, this is our pre-procedure check. The next thing we are going to do is introduction. As I mentioned in my previous video also, that introduction, you all know that you need to introduce yourself, you need to give your introduction and ask the patient introduction. You need to check patient ID, address, patient ID, name, date of birth, and full address if they are in community setting. And then after checking the patient ID, you need to check against your notes and the patient ID band if they are in the hospital. And if they are at home, then you won't have they won't have a wristband, so you can just ask the patient address, check the patient address. Now this subcutaneous injection we are going to do today, right? So you can ask the patient, like, if they need anything before you do the injection, if they need you to do anything, if they want to use the toilet, or if they are in pain. Now here, most of the time in the OSCE exam, we will get insulin injections for subcut insulin, or you may get Klaxin or heparin, whatever, but mostly it's insulin. Now for insulin, what you need to know before you give your insulin, you need to know the blood sugar levels of the exam of the patient. So before you start, you just ask the assessor, can I please know the blood sugar level of the patient? If the assessor says it's in the therapeutic range, then you start preparing your things. But if you don't ask, how would you know that patient blood sugar is okay or not? And then if you go ahead and give the insulin without asking the assessor, it's a big no, guys. It's a big no. And then please make sure you remember to ask the patient blood sugar before you start preparing your equipment for insulin administration. Now the assessor said the insulin blood sugar level is all right. Now what we are going to do next, we need to prepare the things that we are going to use for insulin administration. We need to check all the equipments you're using. We need to check the insulin syringe that we're using, its expiry, its integrity, and then if the prescription is valid and legible, you need to check 6 hours of the medication that we're going to give. You need to check if your prescription is valid and legible, and you also need to say it that I have checked the right patient, right dose, right drug, right time, right documentation, and my prescription is valid and eligible before you start your medication administration. So we have checked all the papers, we have checked the prescription, and we have taken our insulin needle, insulin syringe, and the medication vial. We have checked the expiry date, and that if it's insulin vial and it's been opened already, you need to make sure that it is within 28 days, then you can use it. If it was open more than 28 days, you cannot use it. If it's a new vial, it's very good. And now if you're using ampule, that you need to clean it before you open it. You need to clean it with the alcohol swab as one go. Just clean it once and then let it dry. You need to also wear gloves and apron before you start preparing your medication. And then when you withdraw your medication, make sure you know the technique to recap. The technique to recap the insulin syringe. We always use like ups and down. You put the cap of the insulin needle ups and down and just recap it, or just use a scoop method. Whatever you feel it's easy for you, just do that one, and then practice it also before your exam. As I said, you need to know the recapping method. Please don't do it with your hands. And when you withdraw the insulin, just check with the assessor. If the prescription says 10 units, just check with the assessor. Assessor, I've taken 10 units of insulin, and just show it. Like, they need to see it. Show it to them that this is my insulin, I've taken 10 units, can you please double check with me? And also, even in real life, for all the insulins, we double check the prescription, we double check the insulin, and we double check the amount we have withdrawn. So make it a practice of doing it. Check with the assessor that you have taken 10 units of the insulin. Now the examiner says that yeah, it's correct, and then you have prepared all your things. Make sure you dispose of whatever things you have used. If you use the syringe wrapper of the syringe and the other things, or alcohol swab, just discard it right away. No need to make a mess over there. Now we are starting with the actual procedure. We have done pre-procedure, we have done introduction, we have prepared our medication, and then all the checks have been done. Now we are going to give the medication to the patient. This is our actual procedure. So in this actual procedure, we are going to take a medication and the prescription chart to the patient. Again, it is a medicine, so we need to check the prescription, we need to check the patient name, date of birth, hospital number, against patient ID, and the notes we have, and also the allergies. Don't forget the allergies. Now again, make sure this is a medicine. Insulin is a medicine. You do need to check all the checks, and then you also need a patient consent again before you give the medication. You can also explain to the patient that 6 hours have been followed and they are all correct. I'm happy to give you this medication. Are you happy to take the medication? And then they say yeah, and then you also assist them in the required position that you want. If you want them to lie down, if you're giving on the tummy, ask them to lie down, expose the area you want to use, and throughout gain the consent of the patient throughout the procedure. Then you need to locate the site of the injection that you're using, and also for the insulin, if patient is getting insulin 3 times a day or daily, you need to rotate the sites of the injection. If you have given on the right side of the abdomen, let's give on the left side today, or because we need to rotate the sites of the injection whenever we give injection. And also with the patient consent, as I said earlier, you need to remove the garments of the patient and then maintain privacy and dignity. Don't just dispose of uncover the patient. And you need to make sure, we mentioned earlier, right, in the pre-procedure check also, that we need to maintain privacy. But when we went out for our drug preparation, we removed the curtains, right? So again, you need to maintain privacy before giving your injection. And also for the skin side that you're using, you need to ensure that there is no inflammation, there is no edema, infection, or skin lesion before you inject the needle. So we have exposed the area, we have gained the consent, and now we are going to inject. So you can clean the injection site with alcohol swab and let it dry. When it's dry, you need to pinch the skin and then insert the needle at 90 degrees. Since we are giving insulin needles is a tiny needle, so you can give at 90 degrees. So inject the needle at 90 degrees. If you're giving heparin or what do you call it, Klaxin, now we have pre-prepared Klaxin also, so you can give at 90 degrees. But if you're using manual needle, the other needle that we use, 1 mil needle, then you need to give at 45 degrees, guys. But if it's a prepared Klaxin, it comes with the needle that we need to use at 90 degrees. Make sure you remember, insulin is given always at 90 degrees because we have a tiny needle, but the other subcut injections we need to give at 45 degrees. Now you have injected, and then you need to count loud for 10 seconds. You can count 10, 9, 8 like that, and then withdraw the needle rapidly. Apply gentle pressure and do not massage. Do not squeeze or massage, just apply gentle pressure with the gauze. If we are using insulin needle, well and good. If you're using the other needle, you need to make sure that you put on the safety cap. Yeah, just turn on the safety cap and then dispose of in the sharp bin. I forgot to mention one thing. While preparing our things, while preparing our insulin, you need to take a sharp bin and the BNF with you. Sorry guys, I forgot to mention earlier in the preparation stage. So make sure you take your sharp bin and BNF with you. And then after recapping, or after activating the safety device, just discard the needle right away in the sharp container. Again, we have discarded our sharp things, and then we also need to dispose of the things we were using. If we are wearing gloves, if we have opened any alcohol swab, we need to discard of all the things. If we're using the disposable kidney dish, we need to dispose of right away. But if we are using the metal one, we need to wipe it with the cleaner wipe. Yeah, we need to keep our space tidy. And then now we have given the insulin. You can tell the patient that I've given you insulin. Make sure you eat something, or if you have anything before giving the insulin, you can ask, do you have anything to eat? If they have already eaten, well and good. If not, you can tell them that within 30 minutes you need to eat. And now we have given the insulin. We need to document. Make sure you document it correctly with your print name and signature, time and date of the administration. And again, before you leave the patient, you need to make sure that your patient is safe. Safety rails are up, if they're using bed rails, if they are up. And then ask the patient again if they want you to do anything, if they want you to use the lube before you go. And tell them also that I'll be back, I'll be checking on you after some time. So we have checked all the things. We have given insulin. We have made sure patient is safe and comfortable before we left the ward. And then you are also telling them to eat. You have told them to eat, and then you have also told them that you will be checking on them after some time. So that's it, guys. Don't forget to perform hand hygiene in between. Don't forget to perform hand hygiene while you preparing your things, when you remove your gloves and apron. Make sure you do hand hygiene before you give the injection, before you do anything. And then always remember that you need to know the times when you need to perform hand hygiene. Yeah, just keep in mind, everything is important, because someone is watching you doing everything, and it's for your safety and for patient safety. Sometimes candidates forget to clean their hand after removing the gloves. And then also you need to remember that what's the procedure for donning and doffing of the gloves or apron. You always remove the gloves first. You put on gloves first, but you put on gloves at last when you do your PPE, but you remove gloves first of all, because they will be the most contagious item that you have worn. So make sure you remember to take off gloves when you are taking off all the PPEs. And then don't forget to thank the patient that they have given you their time, they have given you concern for all the procedures. So make sure you thank the patient. And then you draw the curtains, right? So make sure just put them back. And then that's it for today. We are done for today. I hope this video was helpful, informative. If you enjoyed this video, if it was helpful for you, if it was informative, please let me know in the comment section. Like, share and subscribe. Share it with your friends and colleagues who are preparing for Osce. I remember when I was preparing for Osce, there was nothing on the YouTube I could find, and it was so difficult. When we came in the UK, it was all overwhelming. That's why I decided to make YouTube videos to help you guys who are sitting in their home countries and then thinking that they will go to the UK, they need to do the Osce exam there. That's why I decided to do it, so you can prepare back at home. You can prepare for your Osce, then it will be easy for you to do it in the exam section and prepare it here. Most of the hospitals, they provide training sessions for the Osce, which is very good. We got also the training for Osce that was really helpful and informative, and then they train you throughout the procedure. But guys, still it's overwhelming. It takes time, it takes loads of practice. So make sure that when you're home, you don't have anything, you have passed your CBT, you have passed your IELTS, so you have time. So just prepare for Osce when you're back home. Give it some time, and then you can do it like in first sitting. Yeah, okay, thank you so much for watching. Have a good day. Hope you enjoyed the video. Give it a big thumbs up, guys. Thank you.